our weekly webcast here. Now, many of you who've been at Gentian know the format we've normally had. We've changed it up a bit. I want to actually have David Adams from a team that we get together with on a very consistent basis. I'd like to have David kick this program off for us this Wednesday. Go ahead, David.
Thank you, Chris. And thank you all for joining our Health and Wellness series. I'm David Adams, as Chris said, here in Nashville, Tennessee. And I think we have today a very timely session that I hope that you'll benefit from. This is part 2, as last week, several of you joined. We had Dr. Gladden discussing ways to stay healthy during COVID, and also some general health tips and ideas with supplements and that sort of thing. And we're going to have a replay for that video this week, and we're also going to record today so that you can share it and watch it again as you choose. There's also a Q&A button on the bottom of your Zoom screen, and we're going to be monitoring that throughout this session and do our best to answer all of your questions at the end. And so Chris Doty and Tim Freeze, who are also on today, are close friends of mine. They're also in a top advisor study group, and I've really enjoyed collaborating with them on various holistic topics like this, really with the goal to help our clients' overall lives, not just their finances. That's something that we're really passionate about and we share in common. So today's topic is on mental health during these interesting and difficult times. And I'll say, you know, it's no surprise to all of us that people have been really struggling emotionally with the lack of connection and community, maybe even losing their jobs, and some people losing a loved one to the virus. And so depression and anxiety stats have really gone through the roof. And unfortunately, we've seen the same thing with suicide rates. So Chris, in a minute, is going to introduce our speaker today. He's a very special guest speaker. And we hope that we can provide you some guidance on really how we can all stay more positive during this time and help avoid and hopefully come out of any funks or mental and emotional struggles you may have been in and been experiencing. And, you know, I can personally attest to how hard it's been not seeing clients and missing the energy and connection that we in our office really get, and that fuels us through the work days. So not being able to see my parents, you know, to help keep them safe, that's been really difficult. And just missing the team who's been mostly working from home for months. But I am very thankful and hopeful that we all start getting some normality back in our lives and that we can really appreciate all and any of it. And my personal hope to all of us on this call is that we never take for granted, again, the power of human connection and the simple things like going out to eat, right? So again, so grateful for all the lessons that I've learned and my team has learned during this time. And I'm going to let my dear friend Tim Freeze now say a few words.
Great, thanks a lot, David. Hello, everybody from Chippewa Falls, Wisconsin. David, I couldn't agree more. We're also seeing the effects of these disconnected, uncertain times with our clients and our team, family, and friends. Focusing on the positive has been our message. It's been an opportunity to slow things down and reflect and prioritize what's important in our lives. An example for us, I mean, I couldn't imagine a year ago having 2 straight months of dinner at the table every night with our 17 and 20-year-old kids. I mean, that in itself has been an actual gift amongst all of this craziness. So, and I can't even imagine a better time to hear Dr. Lehrmann help us understand more about all of this on the psychological side of things. And Chris, hey, before I turn it over to you, I just want to thank you and Ashley and your whole team for all the work that you guys have been putting in and setting this up. So thanks a lot.
Thank you. Thank you, Tim. We appreciate that as well. So for those of you who don't know me, I'm Chris Doty. We are in Mequon, Wisconsin, a suburb of Milwaukee. For those who you do know me, I'm Chris Doty. We're in Mequon, a suburb of Milwaukee. But one thing that we do here, one thing that's big, and we've all talked about, we like to go big. So we begin in gratitude, every program that we're on. So what I'd like you to do right now, and what's a bit different, take a quick moment, take out a pen or pencil. What I'd like you to do is to write down something you're grateful for in the last 30 days. Just write down one thing. Some of you are going to have a bunch of them. Some of you who are Gentian have your Gentian gratitude journals. But take a moment right now to write down a couple of things that you're grateful for over the last 30 days. So I'm going to take about 30 seconds to give you time for that, and then I'll explain why. All right, some of you still may be writing. I can see your pens moving, actually. I'm joking, I can't. But the whole point of this is going big. I like to start with something funny sometimes as well. So for me, I'm extremely grateful for the rotation of the earth because it makes my day. Now you might go, what? I can hear you laughing. I know it's funny. No, actually, for myself, it's the slowing down during this COVID time, much like Tim, and actually spending time being deliberate and intentional. All of the things we used to be busy with, I begin to appreciate now the simplicity of being at home, not having a schedule, hanging out with my children and wife on a more consistent basis, watching things, talking together, and having dinner together. One of the most important things about gratitude is it just takes a small bit of positivity to take away the VUCA and the negative in the world. So I like to start everything with that go big mentality. Mental health is extremely, extremely important. And one of the things is it's unseen. So when you see physical health, we can see there's some physical problem potentially going on. But what you don't see, you can rock right past somebody who has mental health issues. So bringing Dr. Lehrmann on today, I think is going to be a wonderful, wonderful piece. One thing about this social distancing that people have been talking about, I'd like to change that terminology. We've talked about it, Tim, David, and I, and our whole team. Let's change that from social distancing, which is the wrong terminology, to physical distancing. You need to be 6 feet apart, but closer than ever. And I think a lot of what Dr. Lehrmann is going to bring today is really going to support that piece as well. So without any further ado, what I'd like to bring on is, is Dr. Jon Lehrmann. He's a professor and chair of the Department of Psychiatry and Behavioral Medicine at the Medical College of Wisconsin. He's also the Associate Chief of Staff for Mental Health at the Milwaukee VA Medical Center. He's got a CV that's phenomenal, and he's got all sorts of great background, but I'll just start with that. Dr. Lehrmann, it's great to see you. Thank you for coming on. Thank you for giving us your expertise and helping us get through this incredibly trying time, almost probably a historical time that we'll look back on and go, man, remember that. So thank you, Tom.
Thank you, Chris. Thanks, David. Thanks, Tim. It's a privilege to be with you and with your audience today. As it was stated, I'm a psychiatrist, and this is an unprecedented time. This is historical, and in so many ways. And we really have actually multiple crises going on right now. There's obviously the COVID pandemic crisis. There's the financial crisis that's secondary to the COVID crisis, but then there's also the racial injustice and crisis that we're in across our world too. So mental health is really important. There's no health without mental health. And COVID has really stressed us in so many ways. First of all, it hit us and really took away everybody's sense of control. And what did we do as a country? Everybody went out to get toilet paper to get back into control. It actually is connected to your own development. One of the first things we do as we learn how to control is potty train. And so it's really even unconsciously tied to that. So it wasn't a surprise to psychiatrists that that's where people went. But we need to be in control. And this came from out of the blue and just totally knocked us off our feet. I really like the point that Chris made about physical distancing. It's been called social distancing, but that's a mistake. If we are socially isolated, it's going to really affect our mental health and our well-being. And so we can physically distance ourselves to be safe from COVID, but that doesn't mean we should be socially distancing ourselves. And we have so many different ways we can stay connected. And that's really important through this. Unemployment has been stressing us. Many of us, almost a quarter of our population is unemployed. Homeschooling, for those of us who are having to work from home, who still have the privilege of having a job, we're trying to also take care of our kids because they've been sent home. And how do you do that all from one home? It's really challenging us. There's the fear, the actual fear of contracting this life-threatening disease. It is life-threatening. It is taking lives around us. And then on top of that, there's the fear of spreading it. If we have a mild case of it and don't even know we have it, that's one of the really scary aspects of this disease, is that there's some of us that are carriers and we don't even know we have it, and yet we could spread it to our loved ones and they could die from it. Then there's the loss associated with COVID, and And there's so many losses, and I'm going to be touching a little bit on that and the importance of grief and working through grief. So there's increased trauma associated with COVID. If you're facing, actually, to be diagnosed with post-traumatic stress disorder, you have to be exposed to a life-threatening situation. Well, we are all being exposed to that right now. Yes, it is taking mostly the elderly amongst us, but there are people in their 30s and even younger that have been taken by this illness. Stress can trigger and exacerbate anxiety. And some of us already have anxiety disorders, and you add this stress, and that makes those of us who have anxiety disorders, it exacerbates those conditions. But then because of all this new stress, some of us are developing anxiety disorders and panic disorder and generalized anxiety disorder. We're seeing depression rates increase. Part of that's because of all the losses. Part of that's also related to the social isolation and social distancing that people are experiencing with this. We're seeing increased utilization of alcohol and increased addiction. That's one of the ways that many of us cope with things is we try to numb things, and using drugs or alcohol is one of those ways. And it can actually be very dangerous and lead to addiction or worsening of addiction situations. Chris mentioned the increased suicide rates. Historically, suicide rates have always gone up when we have downturns in the economy. Well, we have that going on right now. And we already had elevated suicide rates. In the United States, suicide rates have been up almost 30% since the late 90s. I'll say in Australia, already they've had more deaths from suicide than they have from COVID. And I think that's coming. That's coming to the United States. So how do we address that? We need to maintain our mental health. We're also seeing increased rates of domestic violence, and that's very concerning. But when you're all closed in together and with all this stress, it can lead to more domestic violence. So I want to go over some tips for coping with COVID. I think around the control issue, first of all, it's really important to keep to your daily routine. So you need to get up on time, your regular wake up time. Don't sleep in, get up and get going. Take your shower, take care of your normal things that you take care of every day. Follow the sleep hygiene rules that help you sleep. What does that mean? That means sticking to your bedtime, sticking to your wake up time, trying to not take naps. If you take a nap, you'll likely want to stay up later. Watch the amount of caffeine you drink, especially in the afternoon and evening hours. Again, alcohol, it actually might make you feel sleepy when you drink, but it actually worsens your sleep. It causes early morning awakening and a restless sleep, so you don't get a restful sleep. So you've got to watch how much alcohol you're drinking. Exercise regularly, and that actually helps promote sleep. So trying to exercise at a regular time, not right before bed, but at a regular time during the day, that will also help you with your sleep. Regular exercise is also important for so many other reasons. And yes, you might not be able to go to the gym because the gym's closed down, but find a routine and find a way to exercise every day in your home, or at least in a social distancing acceptable way. That can be just going for a nice long walk every day. But it's really important. Actually, it has antidepressant effects and actually helps with anxiety when we exercise regularly. So it's really helpful and important for your mental health. Stay connected with your friends and loved ones. Don't let the social distancing be a reason not to stay connected. We still have telephones. We still, now with our technology, we can do it through the internet, but stay connected. Also, take advantage of this opportunity to be with your family more. Find ways to have quality time. Stick with a healthy diet. Watch your alcohol intake. And that's concerning. Right now, alcohol sales are up like 26% across our country. So we are drinking more. Be careful. That's dangerous. Don't watch too much of the news. That's depressing and it'll bring your mood down. I mean, it's okay to watch it once a day, but if you watch it all day and just watch those COVID deaths go up, that's just really depressing and doesn't do you any good. It's overwhelming. Process your feelings and your losses with your friends and loved ones. Seek help if needed. Telemental health is available. There's employee assistance programs. Don't forget about those. Also, take advantage of this time if you have some time and do some self-improvement kinds of things. Is there some kind of extra credentials you wanted that you can do some homeschooling right now off the internet while you're maybe furloughed or while you're on the sidelines? Or do some home improvements, fix up your house more, but do some things that make you feel like you're accomplishing something. I think that's really important for mental health. I'm going to talk a little bit about those losses and grief. There's so many losses, actual losses of loved ones, loss of jobs, loss of people around us, but also there's perceived losses, the loss of freedom with this COVID containment that we're doing, the loss of community, loss of going to community events, anticipated losses, early retirement plans likely may no longer be possible. You may have to work longer. So there's a lot of losses associated with this. And whenever you have losses, we have grief. Grief is a normal process. According to Kubler-Ross, there's 5 stages of grief. First of all, it's denial. Then there's anger. Then there's bargaining. Then there's depression. And then there's acceptance. It's normal to go through all of those phases when we have major losses. And so we're going to have a lot of feelings. The way that you get through them is through talking with loved ones and working through them with friends so that you can work through those feelings. And it doesn't happen all necessarily in that order that I gave them. And you go back and forth, and it takes time. But it's important to work through that grief. If you don't, if you get stuck, it leads to depression. Some of the physical symptoms of grief include fatigue, nausea, trouble breathing, trouble sleeping, and physical pain. So those are actually physical symptoms that people can have with grief. Again, working through those feelings will help with all of those symptoms. So you need time to work through your grief. You need support from friends and loved ones. Be kind to yourself. During these times where we're also stressed, be kind to yourself. You may not be able to accomplish as much as you normally can during normal times, and especially if you're in the midst of grief. Honor your loss. Do something to remember the loss of your loved ones. Acknowledge your pain. It's normal to feel pain when you're hurting from a loss like this. Engage in activities that bring you peace, activities that make you feel good about yourself. I know Chris talked about being grateful and how important that is. Being kind, helping others, that can also help you move forward. Focus on healing. Reach out to those who have had similar experiences and support them, but you'll get support too. Grief support groups are out there and available for you, and they're doing them virtually now. I've never had facilitated a support group in my career virtually. I'm doing that now. I have a support group for those who are furloughed in my institution, and it's been very important for them. There's barriers to working through grief. Addiction is one of those. So if you're numb all the time because you're drinking too much, you're not going to work through these feelings, and it's going to make you get stuck and get depressed. You need to give yourself time. You need to, another barrier is that we can't even have funerals right now, and funerals help us grieve. They're set up to help people grieve. And so you've got to figure out other ways than through the virtual systems we have to support each other and help ourselves grieve. And then obviously the social isolation, we should be physically distancing, not socially distancing, but that plays a role as a barrier too. When should someone get help if they're getting stuck in their grief? Some symptoms or signs of that is if there's excessive guilt about the loss of their loved one. If they start to think that they should have died instead. If they start thinking that that their life is not worth living. If they're having trouble trusting their loved ones. If they can't perform their daily activities. Those are all signs that they need help, and there is help. I'm going to talk a little bit about major depression. It's a major mental health illness that causes more suffering in this world than any other illness, including cancer. And it's prevalent. The lifetime prevalence for this is about 15% of us will have this in our lifetime, and it's twice as common in women than it is in men. It can occur at any age, and there's an increased risk of it occurring when we've lost loved ones. And it occurs in all socioeconomic classes. Untreated, this illness can last up to a year or more. Treated, we can often resolve it within 2 months. The risk for recurrence, if you've had major depression, up to 85% will have a recurrence sometime in their lifetime. The symptoms of it, problems with sleep, problems with appetite or change in appetite, decreased energy, suicidal thoughts, inability to enjoy things with a decreased sex drive, decreased concentration and memory, decreased or depressed mood, feelings of worthlessness, feelings of helplessness, feeling excessive guilt, irritability, psychosis. You can even lose track of what's real and what's not. And oftentimes if somebody has psychotic symptoms when they have major depression, they tend to be very morbid about maybe of ghosts of the loved ones they've lost, or about parts of their body rotting, things like that. If you have 5 or more of these symptoms ongoing for 2 weeks or more, that meets the criteria for major depression and means you need treatment for it. Some of the things to watch for in our friends or our family members, if they're isolating, if they are sad all the time, if they have less energy and motivation, as work colleague, if they're decrease in their productivity, if they have an increase in their errors in their work, if they're falling asleep because they're not getting enough sleep, those might be some things to look for. The good thing is that, again, major depression is very treatable. The best treatment is a combination of medication and talk therapy, and it's readily available. You can even get started on a medication from your primary care provider most often. So you don't have to necessarily see a psychiatrist, but you can see a psychiatrist, and we're seeing people virtually, even in the midst of this COVID. Almost 100% of our outpatient work now is virtual during this time, and actually is a silver lining because it's actually more friendly for the patient in that they can get the help in the privacy of their own home or in their own business in their office, and that actually helps us get past the stigma that can be associated with it. I'm going to mention a little bit about alcohol use disorder because it's very prevalent right now. The lifetime prevalence for alcohol use disorder is 10%. 10% of us will have problems with alcohol in our lifetime. The prevalence is equal between males and females in all races, and the age of onset can be any time in life. The symptoms of it tends to cause problems in our life around us. We get a DUI, we're drinking, and it affects our work, and yet we continue drinking. That's one of the biggest signs. If you can't stop, even after it's really messed up your life, that's a big sign that there's something wrong and you need help. Usually the amount of use and the potency of the alcohol we use goes up as we get more of an addiction. We get physical dependence on the alcohol and psychological dependence. And then there's withdrawal symptoms. If you're drinking heavily every day in the morning, you'll start to have withdrawal symptoms, the shakes, and your blood pressure and pulse, and you get sweaty, and your blood pressure and pulse go up, and temperature goes up, your breathing rate can go up. It can even lead to severe withdrawal symptoms of seizures and delirium, and that can be life-threatening. So if you start getting physically dependent upon it and having those withdrawal symptoms, again, get help. We can help you get off of it. Alcohol use disorders can be lifelong illnesses, and they're often recurrent. People have often recurrent episodes of drinking. Even after they've stopped for a couple of years, they can have, because of stress, they can relapse. There's negative effects on every organ system in the body from alcohol if we drink too much. It leads to dementia. It causes muscle wasting. It causes ulcer problems. It causes cardiomyopathies, or problems with our heart and how it beats. It causes liver inflammation or hepatitis. So it really it has a very negative effect if you're drinking too much every day. 1 to 2 drinks a day is reasonable. More than that, problematic. So be careful. Again, what to look for in a family member or loved one: change in productivity, slurred speech, smelling of alcohol. Obviously, with the virtual world, you aren't going to smell it. Decreased coordination, irritability, volatility, isolating, tremors in the morning, poor attendance. With alcohol use disorder, there's a 10% lifetime suicide risk. I forgot to mention with major depression, it's 10 to 15% lifetime risk. So again, the risk for suicide is very serious with these illnesses. There's other addictions. I haven't talked about and don't have time really to talk about the opiate use disorder problem that's going on across our country right now. But in our state of Wisconsin, 800 people die a year right now from opiate use disorder, overdoses, accidental overdoses. And that's more than have died from COVID. So it's a major issue across our country right now. And if people know people, there is help to be gotten. There's medication and psychologically supportive treatments available to help people with that. There's other addictions. There's stimulant use disorders, sedatives. There's cannabis or THC, and that can lead to problems too, and amotivational syndrome. So we've got to watch for problems with those drug use and overuse. Again, there's treatment for all mental illnesses, and we have very effective treatments. We have to be patient though, because oftentimes our treatments take some time. Our medications usually take a couple weeks to even really start to kick in and have their positive effect. And again, most mental illnesses are best treated with a combination of medication and psychotherapy. Some of the key points I wanted to make today: reach out to your friends and your loved ones. Make sure you do that. You can make a difference in their lives as they're feeling socially isolated. And you can make a difference and make them help with their mood and improve their day. And by you giving to them, you're going to feel better yourself. Take care of yourself. Do the things that I talked about earlier. Exercise regularly. Make the most of your family time. Do some self-improvements or home improvements. Gratitude, as Chris talks about. It's really important. We need to find something to be thankful for every day, and that will help you with your outlook of life. Because even when things are really bad, we still have things to be thankful for. Finally, it's a strength to get help when you need it. So if you need it, get help. And I'm available for questions. Thanks very much.
Awesome. Thank you, Dr. Lehrmann. That's absolutely fabulous. You really hit quite a few incredible points. I was taking notes the whole time. I got about 412 questions myself, but I'm going to actually let David, let Tim, but there's also a question I think we have on the question and answer. David, you want to run through that one?
Yeah, I'll be happy to. Question we got is, can mental health struggles, hold on one second. Can mental health struggles cause reproductive issues due to the chronic stress placed on a woman's body? I have noticed an increase in pain and irregular pain there, and I'm a bit concerned on the long-term effects of the strain that I'm experiencing right now.
So that's a great question. Thank you to the audience member who forwarded that. Absolutely. There's no question that stress affects our hormones, and our hormones are very involved in our reproductive health. And so there's absolutely no question that increased stress plays a role, and it can make somebody's menstrual cycle go off cycle, and it can lead to lots of other problems around reproductive health. It can lead to the inability to be it can affect your function, your sexual function, seriously too. So it can take away the enjoyment of sex. It can, for males, it can affect your ability to have an erection. For females, it can also affect your ability to have orgasm. So in so many ways, the stress can play a significant role. So one of the important things then is handling the stress. You might not be able to avoid all stressors, but how do you handle it? And again, some of the things we talked about around maintaining your mental health can really help you deal with stress, and then also will subsequently help counteract the stressors and help your sexual function too.
Dr. Lehrmann, thank you for that. There's another question. Are children affected differently than adults?
So thank you, Tim. Yes, definitely. So I'm not a child psychiatrist, but I have several child psychiatrists that work for me, as well as child psychologists. And children, they present differently. Oftentimes, their depression, they don't have the symptoms as clearly shown. And oftentimes, though, there are some similarities. I mean, you see their grades start to go down. They do socially isolate sometimes more so. but they may not be as in touch with their feelings, and especially the younger they are, they may not be able to share that, that they're feeling sad, or it may present with anger and angry outbursts and acting out. So children definitely deal with stress differently. And we if you're their parents, we as parents need to model things well, and we need to check in with them. And so they can tell when we're scared and when we're stressed, and that's going to be stressful for them too. So the better we handle our stress through the different ways that I talked about, the better you're going to be able to help them address their stress. But then again, there are child mental health experts too, and sometimes it's necessary to get child mental health experts involved.
That's outstanding. Hey, Jon, I have a question as well, and it kind of goes along with what you talked about before, and it's through some of the reading and all that I've done with Dr. Gladden and in this topic, doesn't also then this stress release cortisol, and cortisol actually makes you less resistant to the disease or any disease itself? So it reduces your immunity. Is that correct?
Wow, that's really a good point and very insightful, Chris. Yes, the more stressed we are, the more likely we are to get illnesses. You're right about that. It wears down our immune system, and cortisol plays a role in that. And so, yeah, cortisol decreases inflammation, but it actually makes us more at risk for infections sometimes spreading. So it kind of has one effect is it does decrease inflammation, and that can be valuable. But again, if we give people steroids like we do sometimes to help with decreasing inflammation, it makes them more at risk for contracting more diseases. So it's a balance, and you're right. And that balance can be knocked off kilter because of stress.
Hey, Jon, question I got from a client about the effectiveness of meds for treating depression and anxiety. You mentioned this earlier, that it's best when it's part of a full plan of doing therapy, that sort of thing, along with meds. Anything else you would say about meds for anxiety and depression, and then also versus natural supplements versus prescribed?
Sure. For depression, there's several different classes of antidepressants that can be used, but they all take about 2 to 8 weeks to have their full effect, and that is assuming you're on the adequate dose. So you need to be patient with medications. You got to take them every day. They don't work if you just take them as needed on a day when you're feeling more down. That's not how they work. You need to have a certain blood level. They probably affect receptor sensitivity in the brain of neuroreceptors, and or the amount of neuroreceptors. That may be part of how they work, or through secondary messengers. We don't fully understand, but they are effective. And an antidepressant will probably have about a 60% efficacy. So if you have major depression, you start an antidepressant, there's about a 60% chance that medication will work for you. And if that one doesn't, then another one likely will. For anxiety disorder, believe it or not, for panic disorder and generalized anxiety disorder, we oftentimes use antidepressants as well, because they do have an anti-anxiety effect as well. There are other medications called benzodiazepines like Valium and Ativan that have anti-anxiety effects and have immediate anti-anxiety effects, but they also have potential side effects of addiction and sedation. And so they can be used acutely, but oftentimes we use antidepressants in the longer term. Now you asked about supplements. One of the things that you have to be careful about supplements is, there are supplements that are antidepressants. There's one that comes from a certain flower, for example. But when you buy them as supplements, there's impurities and you don't know the exact dose, and there's problems with that. And I'll also say that supplements oftentimes can affect the breakdown of other medications that you're on, because they affect your ability of how your liver works. And so they can affect enzymes in your liver. And so you need to make sure that your physician knows what supplements you're taking. And I wouldn't count on the supplements by themselves. I would go to the doctor and be started on a medication that we know exactly how much you're getting, and we can monitor the effects.
Thank you. Tim, there's another question. Would you like to take that?
Yeah, I have actually another one too. So, Dr. Lehrmann, it seems like there's going to be a, you know, like you said, with Australia, maybe a big groundswell of so many of these issues ahead of us. But there is also the stigma against, you know, that we have to deal with and overcome. How do you see us getting through that? You know, I feel like today this is a good example of, or a good way to kind of make these things seem more normal, right? I mean, it's affecting everybody. Anyway, I was wondering if you could speak to that, and then I'll have another follow-up question.
Thank you, Tim. Stigma still is a real issue today. I will say it's gone down in my lifetime. I've been practicing almost 30 years, and I've seen stigma decrease, which is great. Mental illness is a brain illness. It's as real as diabetes is an illness of the pancreas, and it's treatable. And so as we accept this and understand this, the stigma will continue to decrease. I think there's ways today that we're delivering mental health care that help get past stigma. One of the ways is we're integrating behavioral health care across this country into the primary care setting, so you can get your mental health care when you're seeing your primary care doctor. The psychiatrist might be across the hall and or is supervising the primary care doctor on managing the mental health issues. And there's a psychologist there too, or a therapist. And so you can get it oftentimes integrated right into your primary care system for much of the mental health care, and that helps. I think this virtual mental health care that we're doing now also helps us get past the stigma, because you can get it in the privacy of your own home and nobody has to know that you're going into a mental health clinic. Unfortunately, stigma still exists, but it is getting better. And I think part of the answer for it to continue to get better is for people to share their stories. It can't be secret. And we need to share that we, you know, if I have a mental illness, I need to share that, because then people will understand that and accept it, because anybody can have it. And it's one of the things I see at the VA. Some of the strongest, most heroic people I've ever met, some of the veterans, they too struggle with mental illness. Any of us can. In fact, probably about half of us in our lifetime will struggle with some kind of mental health or behavioral health problem. And so if we accept that and understand that getting help for mental health is a strength, then I think we get past stigma.
Looks like we got another question that just came through. Wait, Tim, did you have a follow-up question to that?
No, you can go ahead and take that, David. That's fine.
All right, thanks, Tim. This question says, I am trying to help a friend whose family member has schizophrenia and has stopped taking meds. He has gotten violent and is ignoring a restraining order. What is the best advice I can give her? She is under a lot of stress and can't personally force her family member to take the meds.
So first of all, thank you for being supportive of that individual and that family. I'll also just, this gives me an opportunity to mention NAMI, National Alliance on Mental Illness. It's an organization that's across our country, actually started in Wisconsin, and it helps support family members and individuals with mental illness. And it helps educate people about how we support each other around mental illness. So that would be a good resource for this individual. But that said, there are also there's a legal system in every state that's set up to help support people with mental illness when they've lost their judgment. And so in our state, it's called Chapter 51. It's a state statute that allows for the police to be involved and to force somebody into care to get help. Other states, it doesn't take the police, and oftentimes it can be that the psychiatrist can get involved and force a patient to be picked up and brought in for care and to be started on a medication. Oftentimes, unfortunately, though, it takes, there has to be some kind of threat for either this person to be harmful to themselves or harmful to somebody else. But with schizophrenia, when people lose track of what's real and what's not, there can be some real threats. And so for example, I had a patient who had schizophrenia who stopped eating because it was his belief that that was how he could become a world-class runner. If he lost enough weight, he could practically fly and be an Olympic runner. Obviously, that was delusional. and his not eating was threatening his life. And I had to use the commitment system and the police to bring him in and have treatment forced upon him. That's challenging and that's difficult, but in the end, he was thankful to me because we saved his life.
That's outstanding. So one thing I was just also looking at in societal pain like this, when it becomes this big and this loss is this big of the many forms you said, both loss, the racial injustice going on, the economy, it takes typically 19 years, they find, for us to forget it, for us to be fully normal again. It's almost a full generation. Does that make sense in behavioral psychology that we still hold this recency heuristic? Like if you go back 19 years from today, you remember where you were when the 9/11 occurred. I remember exactly where I was, remember exactly what it was, but it's become like, oh yeah, that was in the past. How long will this, if we go out 25 years from now, will we feel, do you think, the same way about this kind of event as we did about those?
So that's an interesting question. I think things that are so impactful that affect our lives. We saw the Great Depression affect some of our ancestors. The rest of their lives, they were very careful about keeping everything. They didn't want to, because if they let something go, they might not have it when there's no supplies anymore. And so we saw it change the way people, that changed their lives forever. I think something like this is going to change us and change our world forever. September 11th changed our world forever. And some things will never go back. I'm not familiar with the 19 years, but it makes some sense to me, Chris, that I think when we experience traumas, they permanently impact our brain and impact us. For some, it can be in developing post-traumatic stress disorder. And others, we don't all get PTSD when we're exposed to traumas. Some of us can be more resilient and learn to be more resilient, and there's other factors involved. But this will impact us and will impact our world for years to come. And the longer it takes for us to get an immunization and the more deaths that occur from this, is gonna create even a longer impact. But already I think the impact is gonna be long-term.
It's interesting too to watch the information and misinformation coming on this as well. Just yesterday, the World Health Organization mentioned that they reframed their statement about how it's almost impossible to get COVID from asymptomatic people. But then if you think about that, if they're asymptomatic, but they have it, you just get this back and forth, and then you get, these memes on the media and on the internet and stuff. It's just interesting to watch. So psychologically, that probably also comes into play. We tend to believe some sources that are less reliable because we're closer to them. I mean, there's a bunch of biases that occur here as well. Is that right, Jon?
Absolutely. Biases definitely play a role in this. And what we need more science. And we don't understand COVID that well. We're learning about it as we go. And every day we're learning something more. And already we've evolved. We've adjusted, I think, how, what kind of PPE we need and how that's protective equipment that we're using. We've already made some significant adjustments as we've learned, and we're going to continue. And so I haven't seen the science behind that observation, but I heard that too, Chris, that if, that people who are asymptomatic aren't spreading it. It makes some sense. If you're not coughing, that's how you project the germs, is through your coughing. If you're not coughing, you're going to be less likely. But I think we need to study that more, and I don't think it's been studied well enough to make too strong of a statement about that. That if you are a carrier with many illnesses, people can be carriers and still do spread those illnesses.
Kind of another correlated item that goes with this, and this could be maybe a different topic at a different time, but I know a lot of us, David, myself, and Tim, help a lot of people retire and retirees. What's starting to strike me is, does grief happen with retirement? And I look at this, I can see a lot of the symptoms you talk about, but I can see the need for normalcy. I've got some different ideas on it, but I think as people retire, it's a complete change in their identity at times. Do you think that's part of it as well?
Thanks, Chris. I've worked with a lot of veterans as they retired and approached retirement. And I think for many of us, our self-esteem is greatly based upon what we accomplish in our work. And so I oftentimes do see grief when people retire. That's a loss. It's a loss of this whole sense of themselves and their identity as a physician for me, as a, as somebody in this business for somebody else. And I think that is a major loss. I think it's really critical for people as they approach retirement to make sure that they've got something that they're going to do, that they're planning to do, where they feel like they're still contributing to the world and the community around them. And that can be volunteer work. That can be, it can be something as simple as building birdhouses and giving them to the community. Something that makes them feel that good about giving to others, giving to themselves, and still helps them feel, that they're contributing. And I think that's just so critical. I've seen some people fall into major depression when they just go home and start watching TV and they didn't have any plans for their retirement. The other thing I see is that oftentimes there's a lot of stress in the marriage. When one of the spouses comes home and retires, has these high expectations for the relationship, but they're not used to being together day after day after day. And so the other one goes to work then, and it leads to tension. And so there are challenges, and it's really important to go into retirement with a plan to stay busy.
And I think as David and Tim and myself have talked as well, and our whole team, if you look at this, so there's a big thing. So Dr. Gladden is in a group called Living Beyond 120. He's got a podcast with he and Mark. But the interesting part of it, if you start looking at the mental aspects of living much longer than all of your friends, there's a whole nother aspect, and maybe it's a different call, but you start saying, because it seems like there's a disparity in longevity in our country. There are those who are maybe doing the right things, are very fortunate to live much longer. We've seen 108 recover, 106, 108-year-old recover from COVID. And then you've got some who aren't, who are passing away much younger. So I think, is there a lot of it around aging? I know we know that there's all sorts of things that occur with aging mentally, but is there a lot of this kind of grief or mental stress and anxiety just around aging?
Yes, absolutely. I think as we grow older and live longer, we see many of our good friends and the people we've socialized with all of our life passing away. And so there's a lot of grief that goes with that. And you also grieve the losses of your ability as you age. You may not be able to be as active. At some point, you can't be in athletics the way you were perhaps. And so there's a lot of losses. The important thing is that you grieve them, you work through those feelings, but that you find other things that make you feel good and help you contribute in other ways. And that can be, and there's just so many ways that our older population can really contribute to our world. And it can be through volunteer work. It can be, as I said, reading at the library to kids, and all kinds of different activities that can make us feel good about being able to help and contribute.
We've even seen second and third careers. If you feel as good at 60 or 65 as you did at, say, 40 or 30, we're seeing people launch into second careers, and entrepreneurs we've talked about a lot as well. Well, that's fantastic. I know I could go on with questions and questions. I think it's phenomenal. But how about David or Tim? Any questions from you?
There's a couple of questions that came in from the audience. And so I'll go ahead and read one of those to you, Dr. Lehrmann. What would you call a condition where some days you feel pretty good, and then you have days where you cry a lot and don't know why and how to help someone who has this, and different medications don't seem to help much?
So I'd need to find out a little bit more and probably sit down with this individual. I think this individual would benefit from seeing a psychiatrist or a psychologist and being assessed. I mean, I'll just say this, that one of my favorite mentors taught me that happiness is a sometime thing. None of us are happy, totally happy every day. And going through episodes of sadness help us better appreciate the happiness and the good times too. And so, but that said, if the sadness is so distressing and disabling, even if it's for a few days, then I think seeing a psychiatrist or psychologist to help work on that, and even a psychotherapist to help you through those times and figure out ways to better cope. There are cognitive behavioral ways that, for example, I could think of that might help somebody when they're starting to fall into that, be able to pull themselves out. But there is an illness called bipolar disorder too. And so if those down phases, last a couple weeks and the up phases you know, are also there, then there's other kinds of medications that can also help with that too. So it really depends on the nature of it. I actually don't have a good enough feeling from that description to best give guidance, but I know that there is help out there and that this person can feel better.
All right.
Okay. And the other question is actually a good follow-up on it as well, which is about medication. And when starting an antidepressant and knowing it can take several weeks to kick in entirely, what symptoms do you look for to know if it's the right medication for you? And are there side effects to the medication? Meaning, can it make depression, anxiety, bipolar, et cetera, worse? How do you know if it is or isn't working? And how often do you need to follow up with your doctor to kind of check on things?
Great questions. So usually it's the people around the individual who's getting the treatment that notice first whether or not the medication's starting to work. So if, you know, it might be my spouse that notices that I seem to be looking better and maybe acting a little bit more hopeful. And usually I myself might not be the first one to recognize that I'm starting to improve. So making sure you talk with the people around you, or I think that's really important. There are side effects with medications, and there's potential side effects with all medications. I'd say usually we're able to find an antidepressant that doesn't have side effects for an individual. That said, there are sometimes we have to tolerate a side effect. Could be a sexual side effect. Or sometimes we can give another medication to counter the sexual side effect that is the side effect with the medication. But usually, so we can find a medication that will work almost all of the time. And there's other treatments for depression too, by the way. There's transcranial magnetic stimulation, there's electroconvulsive therapy. Both are effective treatments and approved treatments. There's also esketamine infusion as well. So there's other new treatments and some older treatments that are available for depression that can be used too. But generally speaking, an antidepressant can be found that has minimal side effects for somebody. Now, there is a risk if you have bipolar disorder and you're being started on an antidepressant and you're only on that antidepressant and not on a mood stabilizer, that an antidepressant could trigger you to going into a mania. And so it's very important that your doctor knows what your illness is, because if I have somebody with bipolar disorder, I won't start them on an antidepressant unless I have them on a mood stabilizer as well.
David, any other comments? I've got a follow-up question.
I'm good. I think that was all my clients' questions.
Awesome. So one question I have, you've seen a ton of work in the mindfulness, which I'll ask a question, but also hypnosis as a way to be. Have you seen any clinical data on the benefit of hypnosis? And we can talk mindfulness as a second one, the practice of meditation and mindfulness. Are those helpful as well, the mental health?
So I'll start with the mindfulness first. Absolutely. Mindfulness is very helpful. There's mindfulness psychotherapy, so it can be an approach in psychotherapy that people can take. There's no question that helps with anxiety and helps with depression. I think it's a very good approach and a good practice that you don't have to do it in psychotherapy. You can learn to do it yourself. There's mindfulness, there's books on mindfulness, there's different techniques you can learn online on how to be more mindful. And I think that can be a nice self-help approach too. There's courses you can take on mindfulness that aren't part of psychotherapy. That's just you can join a mindfulness group and learn. And I think that's a great way to get some better insight into your own self, I think, and how to address some of the stresses that you face. Hypnosis can be effective as well. Hypnosis tends to be more effective. It can be great for helping somebody relax. It can be great through the power of suggestion during hypnosis to help somebody stop smoking and things like that. It's not a solution to everything, but there are some focused things that hypnosis can be helpful with. going to somebody who's an experienced hypnotist for certain things can be helpful.
That's fantastic. Well, I would like to thank you on behalf of David and Tim, myself, my team. Really very, very insightful. I think we can continue on with question after question, because I think you'll find that the mind itself is one of those things that people just don't see. It's kind of like the silent piece, but it's so connected to the body and physically how we think. Like I think we talked before, the conversation that you have with yourself is so important, because that's the voice you talk to most. So having a healthy conversation with yourself is an extremely strong part of it, but people don't think of that part. Any last comments, Dr. Lehrmann?
I just want to thank you for having this session. I think we all need to learn more about mental health and mental health care, and especially during the COVID pandemic. There's a lot of challenges out there, and the more we can support each other and the more open we are to learning about our own mental health and helping improve it, I think the better our lives will be too. And the more effective we'll be in whatever we do. So thank you for hosting this. I think your clientele are very fortunate to have you thinking about them in this way, and to create this kind of a session for them. So thank you very much.
Well, thank you. And the gratitude is definitely to you as well. I think what you're offering to the community, what you do for veterans, what you do for just the mental health of all of us here, the community with what you've just offered as well, it's super important. And we are completely grateful for what you've given to us, because it's something that in the past has not been talked about. It's just become something that everybody's willing to talk about. And it's one of the most important components of our health. So with that, we'll end for today. We'll again record this, and we'll get this proof through our compliance to post on our websites as well. Hopefully this has been as beneficial for you as I have seen. Again, I've written down 2 or 3 pages just of notes on this alone. So I really, really appreciate that part as well. And thank you. I really appreciate the time you spent with us, both clients, Dr. Lehrmann, Tim, David, our team. Thank you, and have a wonderful, wonderful rest of your week, and use some of what Dr. Lehrmann said as far as how you can combat this. If you have some of these symptoms, go ahead and do something about it. Don't just sit and suffer. I think there can be a cure to this, and I think that's really what he's shown us. So I just want to say thank you very much, and have a great rest of your week.
And real fast, before we get off, next week, same time on the 17th at 11 o'clock Central, we're going to have another guest speaker, Nicole Kernine. She's the lead nutritionist for the Milwaukee Brewers, a registered dietitian. And we're going to have a good session on that. So be sure to tune in. We'll send an invite and a recording of today's session. Thank you.
Thank you very much. Appreciate it.